Welcome back to America's Web Radio. Let's complete the thoughts on the small group, individual, the working poor. And after that section, let's wrap up this first program, this last segment of the first program, with where we go from here, how we find more details, how we find more information, and how many of you listening to this might want to go to americaswebradio.com and listen to other healthcare broadcasts. Over time, we'll have these broadcasts listed out. This is the first of many, and some websites that you might go to prepare and understand where we're going with some website links that can give you more education around various healthcare reforms, various new ideas. And if you read through some of those, you'll be better prepared. If you listen to America's Web Radio and some of the other healthcare broadcasts, you'll better understand some of the things that are going on in the healthcare area, in the health insurance area, and you'll find it very much worth your while. So let's go on and wrap up and then talk about where we go from here. But many in this uninsured population would be covered by healthcare if small businesses could afford to offer and subsidize the purchase of health insurance. It's that working poor, that young individual, that young family that's starting off in life, that's working for a company. Maybe it's a small company that normally doesn't have benefits because they're struggling just to survive and get a foothold in the marketplace. They'll offer insurance when they get larger and more financially sound, but they don't offer insurance now because it's just too expensive. Well, if we can make that more affordable, they're interested and willing because they need employees now when there's such a low level of unemployment in this country. So the program that we're going to be talking about creates a private market that supports these affordable individual insurance policies and the expansion of affordable small group plans. So what are we going to talk about? Where do we pare this down to? We said we're going to eliminate and sort of start at the biggest piece. Well, the biggest piece we said was about 200 million Americans that currently have health insurance, that many in the political arena today, many of the potential Democratic candidates for president are saying they're going to get rid of private health insurance. Well, that's 200 million people that we're talking about helping. So the program would eliminate the complication of most proposals by focusing on the most problematic part of the healthcare system, health insurance for individuals and small groups. These are the largest affected populations and of most concern to voters. So let's look at the various segments and say, what does this new program we're going to describe in greater detail as time goes on? What is it that we're going to deal with? Well, on the large employer side, yes, we're going to deal with that and create affordable health care, eliminate the Cadillac tax, eliminate the definition of full-time employees, which now says anything over 30 hours is a full-time employee. So we're getting companies that won't let you work overtime, won't let you work more than 30 hours, because if they do, that creates Obamacare mandates and requirements. So the large employers need some help in these different regulatory areas. Small employer sponsored plan, absolutely yes. This is probably the most critical area of the reforms that we're talking about. There we need to be sure that there is guaranteed issue, that we're covering pre-existing conditions, and we eliminate this crazy idea of single risk pool and that price compression that we talked about earlier. Individual policies, again, absolutely critical. Many people would like to have portable health insurance plans as opposed to employer-sponsored plans. Many self-employed individuals would like to buy good individual policies. Many people who are working for small plans that may never offer health insurance until they get larger and more financially sound, they need to buy health insurance policies for themselves and their families. So individual policies is a critical part of our future in healthcare and health insurance reform. So yes, we're going to be talking about that. Again, guaranteed issue and pre-existing conditions is the most critical issues facing that part of the market. And of course, the uninsured, people who have decided they don't want insurance for various reasons, many of which is because they cannot afford insurance. It's not affordable. We got to make this whole thing affordable so that many of that 28.5 million people currently uninsured actually will find it valuable enough, affordable enough to buy insurance They need comprehensive major medical plans. They need catastrophic plans. They need temporary insurance plans. And need many more affordable options, including health savings accounts. Which ones have we eliminated in this process? They still need separate reforms. There's still a lot of issues going on in these different markets. They need reforms, they need more flexibility, and the problems exist because these are already government programs. Medicaid, we need to think about block grants to states and elimination of the waste, fraud, and abuse that exists in the Medicaid program. It is probably the worst program for healthcare that's available in the United States because people cannot get coverage properly provided to them because doctors and hospitals don't accept it unless they're absolutely mandated and forced to on the hospital side. But many physicians simply say, I'm not taking any more Medicaid. I've closed off what I have. I'll service what I have, but I'm not taking any more. Medicare, that needs enormous amounts of reform. We'll probably do some separate podcasts on Medicare down the road. It's got to be changed. It was developed in the 1960s, 1965, and we copied then the Blue Cross Blue Shield programs that were available in 1964. Nobody in the working population coverage, employer-sponsored plans, has a Part A, a Part B, a Part C, et cetera, et cetera. It's a plan that many people like because they don't know what they could have. So we'll talk about the kinds of reforms that should exist down the road in Medicare. It should be things like expanded Medicare Advantage and prescription drug costs under control at a very minimum. The VA, TRICARE, and the Children's Health Insurance Plan. Again, a lot more flexibility in each of these programs and some private care options. These are all government programs, Medicaid, Medicare, TRICARE, VA, and the Children's Health Plan. They all have major problems, to a large degree caught up in the bureaucracy. And once legislation is passed, it's very difficult to improve it, to change it. There's an old saying, that legislation tends to crowd out the future. And that's what's happened in many of these programs. They are ancient plan designs that really aren't the most effective programs. They don't have the newest ways to incentivize and change behaviors to reward good health and healthcare decision making. So those are eliminated, and we'll focus on the biggest part of the market as a start, and then we'll come back and look at reforms in these other areas if we could ever get reform in the private market. So by focusing on the private insurance market alone, these health insurance programs that we're describing shows how conservative solutions will work for what the majority of working Americans are concerned about. It avoids the political demagoguery that Medicaid and Medicare reforms inevitably bring. If that's what Republicans want to talk about, if that's what any politician wants to talk about, such reforms are typically characterized as hurting the poor and throwing grandmother over the cliff. You never get anything done when that kind of demagoguery occurs. We need to have a better time to discuss and openly develop some bipartisan approach to Medicaid and Medicare reforms. In the current political environment, that just doesn't seem possible. So rather than bringing those into the fray at this point, let's set those aside for another time. We should be able to get a more uniform agreement on how to develop a private health insurance market. So save those battles for another day and solve the concerns most affecting working voters. So let's wrap up this first program, this last segment, with a review of sort of where we've been, what we've discussed, and sort of where we're going. Let's refresh ourselves on some of the terminology that's been used in this first program. Healthcare. Healthcare is when one receives services from medical providers, medical caregivers. That's different than health insurance, which is how one finances those medical services. Of course, you can finance medical care in a number of ways. This health insurance is the major way most people finance health care. You can also pay for some of it, as many of us do, with deductibles and co-insurance, with cash, with checks. Many of us also pay for those services with health savings account, monies we put aside that are tax advantage dollars. But those accounts are usually attached and a part of a health insurance program. There's also other ways, flexible savings accounts, health reimbursement arrangements, but health insurance is the main way most people finance medical services. We talked about fully insured group health plans. What are they? Well, a fully insured group health plan is a traditional way to finance an employer-sponsored health plan. With a fully insured health plan, businesses pay a premium to a risk-bearing insurance carrier for the payment of any claims that might occur. We talked about a self-insured group health plan. That's one in which the employer assumes the financial risk for providing healthcare benefits to its employees. Because the employer is at risk, it's usually very large employers that offer self-insured plans. As we'll talk about later in one of the other broadcasts, because Obamacare allows more flexibility under self-insured plans, it's no longer just for large groups. Many smaller groups have designed and developed programs to become self-insured. Many carriers are offering specialized products that are identified as self-insured plans to very small groups in order to avoid much of Obamacare, which creates more anti-selection, creates more problems. It doesn't have to be an insurance company that provides the services for self-insured employers. Many times it's a TPA, third-party administrator, that processes the claims and provides the legal and actuarial and printing services for a large employer. We've mentioned the term socialized medicine a couple of times. Well, what is socialized medicine? Socialized medicine is defined as where the government pays for all healthcare costs, operates the hospitals, and employs the medical staff. Basically, everybody in the healthcare system becomes an employee of the federal government. What's a single payer system? Because you've heard that many times by politicians, by people running for office, by articles that you may read. We mentioned it during this podcast. A single payer is where the government pays for all healthcare costs, but the hospitals and doctors are privately but heavily regulated by the government. So they're not employees, but they're heavily regulated. So where do we go from here? Where are our next programs going to talk about? I hope these podcasts and videos will become the source of education and legislation that can afford individuals with the right kind of health insurance that they want in order to access the health care that they need. For more information and to prepare yourself for Health Insight podcasts, you can follow and go along with many of the presentations that are available on americaswebradio.com. In addition, more on healthcare reform can be found. And if you want to do some advanced reading to better understand the next podcast, you can find more information at www.healthcareinsight.net. Thank you very much for listening, and I hope this was helpful to you, and I hope you'll come back and listen to future podcasts as we completely design our healthcare system